Well, the Indiana National Guard regularly responds to provide aid in emergency situations, but their newest mission is unlike any one they've had before. Thousands of National Guard troops are reporting to Indiana nursing homes. These facilities and their residents are under threat from COVID-19. Conditions improved over the summer, but as Brock Turner reports, cases among the most vulnerable Hoosiers are surging again.
Last week, 400 troops reported to Camp Atterbury in south central Indiana to get their orders. The Indiana National Guard has been helping with the state's pandemic response since March. They've worked at food banks, distributed supplies, and helped increase testing capacity. But this mission is different. Guard members are being sent to 135 nursing homes across the state, with more to come.
We started to recognize the data that was showing this upward trend about 3 weeks ago. And so we started to put the strategy together in that week that has now led to the actual dispatch.
The tasks they'll complete are still largely unclear and undefined. Guardsmen at the training were told to prepare for the unexpected and that their tasks at each facility would vary. The Indiana State Department of Health declined an interview, but provided a brief statement on the goals of the deployment. The state's chief medical officer says a survey completed last month shows cases in long-term care facilities were surging. That's after seeming to level off over the summer.
Through this effort, we identified several themes where long-term care facilities could use additional support. Number one was staffing. Of all the additional measures that must be in place to protect residents from COVID does require extra time from our staff. Staff members have to isolate or quarantine because of community exposures, and all of these things have brought additional stress to those on the front line.
Guardsmen won't be caring for patients, but they will be lessening the workload for nurses and other long-term care facility workers by handling some of the administrative duties. The president of the Indiana Healthcare Association penned an op-ed back in March identifying staffing challenges. When the state announced they were sending the National Guard in, it was the first many had heard of the move. But Cattell insists that's not a bad thing.
I think it's also a matter of when other deployments end and that capacity for available Guard members comes around.
Sure.
I think clearly we see the cases rising across the state, and as we've continued to communicate, the exhaustion of our staff is real. And so I'm glad that all of that aligned at this point, but I wouldn't equate advance notice to a negative or positive experience.
Yet for the majority of caregivers, policy decisions like these are misaligned. Mary Charlson is a primary caregiver for her mother, Mary Catherine, who's a resident at Ben-Hur Nursing Home in Crawfordsville. She wasn't aware of the National Guard deployment, but wishes more time and resources would be allocated to helping families return to their loved ones.
If the National Guard knows what to wear and to come in to protect, why can't we wear their stuff and just come in and see our loved ones instead?
The Indiana State Department of Health continues to reiterate that visitors like Charlson haven't contributed to outbreaks.
When there's an outbreak in a facility, often it starts with the staff, and several of the staff members spread it to each other, and then of course, ultimately it could end up spreading in the residents.
Facilities are products of their communities. As cases surge like they have been across Indiana, infections in long-term care facilities should be expected to rise. Cattell says they're stuck in the middle and have to manage competing interests.
This is a really difficult issue. The long-term care facilities are communities. They are supposed to be home-like environments. Skilled nursing facilities and nursing facilities as regulated by federal law, that language, home-like environment, is part of our regulatory structure. And so this push-pull between really good infection control and public health guardrails, but allowing what used to occur, which is relative unfettered access for visitation, are difficult to reconcile.
Charlson was visiting her mom 3 times a day before the pandemic. With the facility only being 3 miles from her home, it was easy to run over between her school bus routes.
I'll never forget the day that they told me, if you leave now, this is your last visit. You don't get to come back. So I turned around and went back in and stayed even longer. And knowing that I always had to just be my mom's rock.
Charlson doesn't blame the facility and understands why infection protocols are in place. Yet she struggles to understand why more isn't being done to enhance the quality of life of seniors like her mom. In-person, socially distanced visits resumed briefly after the facility's outbreak, but now, because of new active COVID-19 cases, it's been shuttered again.
And my mom reaches out with opened arms, wanting a hug. And you know, they say it's to protect the residents, but to protect the residents from what? What's next in their life? Where are they really going after they leave the nursing home? They're protecting them from loved ones, from our hugs.
Regardless of the barriers in place, she says she's not going to stop visiting her mom. For Indiana Newsdesk, I'm Brock Turner.